Welcome everyone. Today we will explore an essential medical procedure called colonoscopy. This procedure allows medical practitioners to examine the inner part of your colon and rectum, searching for issues such as ulcers, inflammation, bleeding, polyps, and tumors. If you're curious about the nature of a colonoscopy, its operational process, the necessary preparation steps, and its importance, we invite you to embark on this enlightening journey with us. What is a colonoscopy? A colonoscopy is conducted using a specialized tool, the colonoscope. This device is akin to a slender, flexible tube, equipped with a light source and a video camera at its tip. The tube's diameter is roughly equivalent to that of a finger, and its length can vary between 48 to 22 inches. This device is inserted gently through the anus and navigated through the rectum, moving upward through the colon until it reaches the cecum, the initial part of the large intestine. In some instances, the colonoscope can progress even further to the terminal ileum, the very end of the small intestine. The video camera at the tip of the colonoscope relays live images to a computer screen, enabling your doctor to scrutinize the colon meticulously. Now let's talk about how it works. The colonoscope is more than just a simple camera. It comes equipped with a light source, an irrigation channel, and an instrument channel that allows for the insertion of specialized tools. The irrigation channel within the colonoscope serves multiple purposes. It can introduce air into the colon to inflate or distend it, thereby improving visibility for the doctor. Additionally, it can also flush out water to clean the colon interior, effectively removing residual stool, mucus, or other debris that might hinder the doctor's view. This dual functionality allows for a clearer examination of the colon and efficient detection of polyps. Besides, special instruments such as miniature forceps or wired loops can be directed through the colonoscope. These tools enable the removal of polyps and the extraction of tissue samples, known as biopsies, from any areas that may seem suspicious. These samples can then be further examined for signs of cancer. How does colonoscopy unfold? Prior to a colonoscopy, an essential step is the bowel preparation. This process involves a thorough cleansing of your bowel. Without a proper bowel prep, any remaining stool could obstruct your doctor's view of your colon, possibly causing the procedure to take longer or even require a do-over. Effective bowel prep increases the chances of detecting polyps. The prep process includes specific dietary restrictions and the consumption of a bowel prep medication. 3 days before your colonoscopy, you'll begin a low-residue diet, which comprises foods that are low in fiber and easy to digest. You'll need to avoid whole grains, nuts, seeds, fatty foods, tough meat, raw or dried fruit, and certain vegetables. The day before and the day of your colonoscopy, your diet should be limited to clear liquids only. The procedure typically takes between 30 to 60 minutes and is conducted in a hospital or clinic by a trained gastroenterologist. Sedation is offered to ensure you're relaxed during the procedure. While you're positioned comfortably on your side, the doctor carefully guides the colonoscope into your rectum and advances it through your colon. During the procedure, a small amount of air is typically introduced into the colon, widening the passage to facilitate an optimal view for the medical practitioner. This might induce a sensation of pressure or minor cramping, which can be mitigated by slow, deep breaths. The colonoscope's flexibility enables it to navigate the complexities of the colon's twists and turns efficiently. Occasionally, gentle abdominal pressure may be applied, or position adjustments might be requested to aid the scope's progression. Throughout the procedure, a high-definition, magnified video from the colonoscope is displayed on a monitor in real time, enabling a thorough examination of the colon lining. This video can be recorded, and photographs can be captured. When polyps or suspicious areas are detected during the colonoscopy, they are removed, and tissue samples are extracted for cancer screening. Since polyps have the potential to become cancerous, their removal is necessary. The most common removal technique is called snare polypectomy, where the polyp is surrounded by a wire loop and then an electric current in the wire burns off the polyp. The polyp is then pulled through the instrument channel and collected for biopsy. Other methods are available depending on the size and shape of the polyp. Polyps contain no nerves, so you won't feel pain during their removal. After the procedure, patients might experience minor discomfort, like cramps or bloating, but these symptoms should disappear quickly. Despite its invasive nature, the colonoscopy is generally safe, and complications are rare. Possible complications can include reactions to the sedatives used, bleeding from the site of biopsy or polyp removal, or a tear in the colon or rectum wall. In conclusion, a colonoscopy is a critical procedure enabling detection and removal of potential precursors to colon cancer, such as polyps. Despite its invasive nature, it's generally safe and vital for preventative healthcare, showcasing the importance of regular screenings. Thank you for watching.